Welcome to the Care Right podcast, your go-to resource for all things elder care. Guiding us through this journey is Annalee Kruger, the founder of Care Right Incorporated, and she has been steadfastly supporting families across the United States. Each episode brings you expert insights, innovative strategies, and practical advice, ensuring that you're well equipped to provide the best possible care for your loved ones. Expect to gain valuable knowledge, learn from real-life stories, and get inspired to take action in your own caregiving journey. So buckle up as we dive into an in-depth discussion of elder care planning and together embrace the journey of caring for aging loved ones on the Care Right podcast.
Hello, everyone. This is Annalee, the owner of Care Right Incorporated. Thank you for joining us on our Caregiver Crisis podcast today. As you probably know, Care Right is a concierge model working with family caregivers all across the globe and helping you make informed care decisions, understand dementia progression, understand how to navigate the senior healthcare industry, understand how to navigate family dynamics, and all the way through end of life. We also provide virtual patient advocacy for families all across the globe so that you can just be the son or the daughter or the spouse and not have to be the care patrol, the care manager, the care coordinator, all of that. So our job as a senior concierge planner is to make your life easier as a family caregiver so you can just enjoy your family and your relationships through this part of your life. So, as you know, we always find exciting, revolutionary people to get on our podcast who are doing amazing things to help family members navigate this really can be challenging and difficult time of life for whether you're a family caregiver or an aging parent, and we just want to make your lives as easy as possible through providing you with different resources that I have already curated and vetted for you. Today is no exception. I'm really excited to have Claudia Cometa as a guest today on the Caregiver Crisis podcast, and we'll let you go ahead and take it away.
Wonderful. Well, I'm really thrilled to be here, Annalee, and provide any insights I can that'll be valuable to your audience. So I guess I'll give a little bit of a background to who I am for those who aren't familiar with my work. I'm actually a clinical pharmacist by profession, so been doing that since 2003. And for the majority of my career as an employee, worked alongside medical teams in high-risk medication type environments, internal medicine clinics where I was a drug information resource. So just a variety of settings and a variety of states. And then for the first time of any significance, I was faced with the patient experience side of the healthcare equation in 2016, which, I mean, for most people that would sound shocking that for 13 years, I didn't really know what patients were experiencing from any level of depth. I think we have an assumption of what kind of care we're providing and how it's being received. And my dad was diagnosed with lymphoma in 2016, and I was basically forced to see it. And I jumped willingly, obviously, to become his patient advocate, as I was the only one who was medically trained in the family, but really was very disappointed and frustrated by what I saw and felt alongside with him. And so through that year, as I'm, just watching the intense attention I had to details in his care and the level of interaction I had with his team members and watching the others around him not have that, I made a very heart-centered decision for the first time in my life. Normally my decisions are like, very thought out, analytical, linear, just, the traditional academic type of a personality, type A. And for the first time in my life was like, this is a decision I don't even really need to make. I feel like it's already been made for me. It's an intuitively led decision, and I'm just going to move forward, having no idea how to start a business, but knowing deeply how to do the work. I'm just going to let those logistics fall into place as they will. And so that's what I've been doing since 2017, is basically locking arms with the people who work with me and find me and are looking for basically somebody to help them navigate, in many ways that you do. And it's not limited for me to seniors. I actually help people by pediatric age. There's really no limit. And so I have clients who hire me for their children. And so basically keeping an eye on the medical weeds of the medical side. So basically getting involved with their medical team on my dog is snoring behind me. Hilarious, not hilarious. I guess it's gloomy weather we're both having. So,
I can't hear him at all, so you're
I
fine.
apologize. Okay, great. Fantastic.
You're oh, there you are.
So you woke up, poor thing. So the intention is to be a source of peace for people along this journey that is really filled with chaos and stress for the vast majority of people. And that's like any other field. Like, I'm sure you feel the same. If I walk into a car mechanic and ask them to diagnose something and they tell me this and this and this is wrong with your car. I mean, there's just no question. There's no way for me to question that. I don't know anything about cars. And so I'm just going to go ahead and proceed. I guess I might get a second opinion on that, but I have no way of having an educated conversation with them about my car. The difference is it's your life or a family member's life. And that is for, most people way more valuable. So this becomes, there's a heightened level of acuity, a sense of urgency to let's really lock arms and walk through this together so that you have the clarity you need to ultimately make the decisions you want to make, not what I see as the situation or my goals for you, but really what is it that you're seeking out of this, and let's lock arms and make it happen together. So that's kind of a overview of my journey and my dog.
I have a dog too, but he is also sleeping, but this time he is not snoring. So otherwise we would be in the same boat. So tell me a little bit about or tell me about your, we've already touched on your experience with the healthcare system. I too, I've been in the industry for 30 years, working with families across the country and facilitating their family meetings. And unfortunately, most people come to us in crisis mode. They're overwhelmed, they're burned out, they've had most likely a despicable experience in the hospital or senior care world or home care, whatever has happened. Or they're just plain burned out and they're like, look, we don't have enough grit to keep doing what we're doing. We finally have realized that what we're doing, missing work, our families are mad at us. I'm resentful of my parent. My husband's threatening divorce. It's usually some major trigger points like that finally get people to kind of move forward with calling CareRight for their free consult. But it's usually, they've had by now some terrible experience in the healthcare system. So what do you see as some of those whys? Why is this happening more and more?
Yeah, I've watched, my husband's actually a physician, and I've watched the trajectory and evolution of medicine, even just from his perspective. And he works in the operating room, so I don't, not necessarily outpatient type ambulatory care, but I've watched the evolution of what's happened, and it's definitely gone south. There's like no question about it. And it's gone south from both the staff experience. So physicians, nurses, physician extenders, which is why we have such a shortage. The shortage really isn't that there aren't amazing people who want to do amazing work in the healthcare system. The shortage is because they're burnt out and they're looking for other options. They're leaving the field. They're going out to work in their own way, in their own capacity as consultants or otherwise. And they're just tired of the working conditions. So it is very overburdened. It is very much from the top down approach, seemingly profit over people. So, we have executives, and obviously this isn't a blanket approach because I've met some amazing CEOs of hospital, and other institutions, but as a whole, we're not doing a really great job in supporting, the support that comes from top down, or even just an assessment of what the reality is on the front line. There's a real disconnect between decision makers in medical facilities and the actual people providing the care. And when you are overworked and working from a place of complete and utter depletion, and you realize on a very tangible level that you aren't really supported on any way from any of your superiors, at some point there's going to be a breaking point. And so that's when we've got people leaving, and we call it a shortage. And so that sounds, maybe a little bit more palatable to the public, but that's the reality of the shortage is, what I just mentioned. And so you've got really great people who wanted to do well in healthcare who are leaving or, finding their own way around. And then you've got, the transient nature of what that has has provided us, which is travel nurses and locums physicians. And so people are like, okay, instead of being full-time employees at this facility that doesn't care about me, I'll just pop around and still do my work. But if I hate it, I can leave. And I understand that from a provider standpoint. I also realize from a patient standpoint, and now you've got this transiency of people. And so instead of going up to, a surgery for, the third time and thinking you're going to have the same staff, it's like, no, it's people who are there for a week and they might not be here next week. And so the entire system is hurting, and the people who really should have more decision-making power don't have that decision-making power. And then of course you've got like, the other entities like insurance and PBMs. So there's just a lot of hands in the pot, and for the most part, we aren't putting humans over profit. And that's ultimately where things in society break down. That's not just true of healthcare. That's just true of life and society, and even our interpersonal relationships, this is true of life. And so when we lose the humanism in healthcare and the attention to caring for those who care for others, it's going to break down. And that's where we're at. So very much like you mentioned, it's typically some type of a crisis mode. Obviously I think both of us hope to get education out there that, there are people who can help you well before crisis mode. But I also understand that the reality of what we do maybe doesn't become clear until somebody needs it. And then, then there's a search online or word of mouth or whatever, and how they find us. And it's typically in those acute, urgent, emergent crisis type of settings where it's like, I'm not getting the answers I need. I need somebody to help. And the people around me right now don't appear to be those people. So how do I find those people? And then, they'll find, what they need. Most of the time, the internet can work well for that. It doesn't always have great information, but, we do have that ability to use a search function on Google, or, talk to somebody who might know somebody who might know somebody. So they'll eventually find the support they need.
And it's very difficult because I take the stance of, because a lot of our families they'll go by what neighbor Joe did. Well, neighbor Joe's situation could be totally different than what your family situation is, right? So, and like you probably see this too, but most of the families, when they come to us, they assume that Medicare is going to pay for care. They assume Medicare is going to pay like for everything. And so when we talk about aging in place at home, and I'm like, well, that could cost $50,000, $60,000 a month in home care, they're like, wait, what? maybe aging in place at home may or may not be the right fit, depending on, what's your financial runway and stuff like that. We educate our families about the landscape of senior care. Many of the things I've seen too, because you left corporate America, so did I. I just did it earlier than you. I did it 2011, because when you're working 7 days a week, and I used to be an executive director in CCRCs, continuing care retirement communities, and on call literally 24/7. And so when you literally work 7 days a week for 22 years, you get burned out, because you're like, wow, you're just fighting a system that's broken. And so that's why I left corporate America in 2011, because I'm like, well, if I can't have the impact that I know that I can on my own, then I need to go out on my own. But, especially since the pandemic, so I've been in this industry for over 30 years, and I've never seen so many mergers and acquisitions, and something always gains, but something also loses when there's an M&A. But I've also never seen so much turnover in like our key leadership positions in senior care. And I think what happened, my opinion, with the pandemic is all of us seasoned executive directors, or all of the seasoned executive directors, they're like, I want to leave my career on a high note, because they could see the writing on the wall with what's happening with burning out really good, quality, caring, compassionate healthcare workers, and knowing that it's going to be really hard to replace them. And so they wanted to leave their career on a high note as well. But when you have a care community that has months or weeks and weeks and weeks or months of no key leadership, executive director or charge nurse or wellness nurse, or whatever those key leadership positions are, it can be the wild, wild west, and so there's just a lot of reasons why the care has really plummeted even worse than it was before. You've got good quality people. Most of them are good quality people working within a broken system. So I know you've had experiences. I clearly too have had personal experience with my mom being in a memory care community that had months and months of leadership changes and vacancies in leadership. And during the pandemic, it was a terrible experience for her and for most people that were already in a care community. So I actually wrote my thesis on this in 2008 when I got my MBA about the changing landscape of senior care and the shortage of workers because our families are smaller, right? So when families are smaller, that's less family caregivers, which also equates to less professional healthcare workers. How do you, I want to kind of get back to some of the bullets that you had submitted to effectively navigate your healthcare with peace. What are a couple things that someone can do to do such that, besides, bringing you on the team as a professional advocate, what is maybe another way that if they didn't know about you or want to try to do this on their own a little bit longer, because I get that too from families, oh, we can figure this out on our own. And I'm like, okay, but Google will only get you so far. So how is another way that they could navigate healthcare or, healthcare senior care?
Yeah, I think, being a very activated, proactive patient, I think historically what has been modeled for us is we prepare for things in life. We prepare for interviews, we prepare for the first day of school. We're just taught to prepare in many areas. We prepare for lawyers' appointments. We know we have to bring paperwork. We know we have to know what we are presenting to them and when the goals that we want. And then somehow in healthcare, we've just arrived and the magic will just happen, and then we're frustrated when it doesn't. So I think there's just a level of erroneous expectations and limiting beliefs that have been placed on us, and not necessarily faulting our parents and grandparents, but this has been a very generational thing. And I think the tide is shifting there, but ultimately realizing that what we typically did in our grandparents and parents' time of taking a very passive approach, very, in the back seat, I'll just let the doctor who's driving take me where I'm supposed to go, not even telling the doctor where you're trying to go, so we're just going to let the doctor drive me to New York when I'm really trying to go to California. It's not effective. And because of the increasing brokenness of the system, it's even more imperative that people take a very proactive role in their healthcare. So that means going to appointments and knowing exactly what you want to get out of that appointment, being very clear of who you're seeing, why you're seeing them, and what your, primary, maybe secondary intentions or goals are. And, having notes that you prepared in the days and months leading up into that appointment, and really driving the appointment. And instead of seeing that as some type of, disrespect or talking down to a physician, I really see it as consultant meets consultant, right? You've got your knowledge expert, which is the book expert and the person who's gone through medical school. And I will say, I have watched that process with my husband, and it is intense. So they do know a lot. There's a respect for the level of knowledge they have, but there's an equal respect for the level of knowledge you have about your body. And there isn't anybody who can be a better expert on that. And so to not discount that, but to bring that in, and so that there's an equal conversation there, rather than, authority figure or dictator over patient. So I think preparation and just shifting your paradigm around what you see as an approach to health and healthcare, and realizing that what worked for and maybe didn't work, but what just was for our grandparents and parents isn't working anymore. And we really need to shift that. And so just, reframing that.
Absolutely. Well, and the other thing that maybe listeners may or may not be aware of, but the physicians that, they went into this line of work because they wanted to make a difference and help people. But then when insurance or healthcare is really insurance, right? And so insurance dictates what they can actually do for their patients. And a lot of physicians aren't okay with that. So they're leaving and they're doing their own, private practice or, concierge model. And you probably see that as well. But before I left regular physician care. My physician said she said she has 3,000 patients. She's like, there is no way that I can tend properly to all of those people. Right. And so the more that you can be prepared as a consumer, come organized, come with all your questions. Absolutely. That's going to be that the right physician will appreciate that and not be, egotistical about that. Like, I'm the doctor. You have to, you have to be what we call a bold advocate for yourself, not because necessarily the people in the healthcare system are the wrong people, but the system itself is broken. So, and my intention is next year to start the Care Crusade, which is a nonprofit, because every single patient, young and senior, and their family ought to feel confident that the people assigned, the healthcare workers assigned to them, are properly trained, properly managed, properly supervised, and actually, enjoy their work. Well, that comes from the corporate culture, right? So there's a lot of work to do, and every single day, we all have a vested interest in making this healthcare industry much better, because someday it's going to be us using the healthcare system, right? And actually don't even usually call it a system. I call it a model, because to me, a system implies efficiency and effectiveness. And that's just, we don't have that right now with the healthcare model that we have. So, a lot of work needs to be done for this. And so in the meantime, while you and I are out there fighting the fight to help improve quality care, consumers for now are going to have to be a bold advocate for themselves, or hire people like us who are seasoned professional advocates that can really make their life a lot easier and get them much, much better care than what they would have had probably on their own. So any closing comments, anything else you'd like to share?
Yeah, I mean, I guess one more tip is, being attentive to the language that we use around our own health and healthcare. So we speak very societally and say things like, my body hates me and my body's against me and we're fighting disease, and I really teach to shift that and realize that your body's actually your greatest ally. I mean, the things that it's doing involuntarily every single day to keep you alive, it's really not against you. And so I think really befriending your body as you engage with the medical team in a proactive way, also engage with your body in a very ally type of way rather than adversarial type of way. And so that would be a sort of last encouragement with regard to navigating this area of your life with peace. But no, I appreciate this conversation. I think it's important to have. I think people definitely need, and a final lasting point, definitely oftentimes are waiting for permission to make the decisions they need in their own healthcare, which could mean a second or third opinion. It could mean getting a whole new medical team. It could mean not taking a medication that a physician told you to take, and having that conversation with him or her that I'm not aligned with this decision with this medication. And that's okay. Like you have the permission to do that with your own body. So those are some of my lasting thoughts.
Excellent. And am I correct that you also wrote a book?
I did. Yes. It's called Patient Empower Thyself, and talks a lot about what I've just talked about, but in much more detail. And that will be launched in next year on World Cancer Day on February 4th of 2025, but it is available for pre-order now. So you can find that on Amazon, or on my website is Peace Advocacy Group. And you can either click on book or go peaceadvocacygroup/book.
Excellent. And if for those of you who are wanting to jump into reading another book, I too wrote a book. It's called The Invisible Patient: The Emotional, Financial, and Physical Toll on Family Caregivers. You can find it on Amazon if you choose to look there. It's also on Audible, because I know family caregivers are often too busy to just read. So if listening is a better solution for you, it's also on Amazon, on Audible, or you can buy it directly from the book's website, which is invisiblepatientbook.com. That way, at least I know who ordered it. The downside of Amazon is I don't know who ordered it, so I can't follow up and say, hey, thanks for ordering the book. And then help them further if they get stuck with putting their own aging plan or family meetings in place. So, Claudia, this was fantastic. Thank you so much for being our guest today. And I just really appreciate you and all that you're doing and the impact that you're making on these families across the country as well.
Wonderful. Thank you so much. And I feel the same, very much mutual. Thank you.
That's right. All right. Thank you so much.
Thank you for tuning into the Care Right podcast. We hope today's discussion has provided you with valuable insights. If so, don't forget to like, subscribe, and share our podcast with others who might find it helpful. Remember, Care Right is more than just a podcast. It's a community dedicated to supporting family caregivers with comprehensive care planning, crisis management, and resources for every stage of aging. Stay connected with us for future episodes as we continue to explore essential topics in aging planning, elder care, and financial planning. Until next time, take care, plan wisely, and remember, you're not alone in your caregiving journey.